Hi, it's Jeff here from Ambition Health and Performance. Today's video is how to get rid of tightness that may be causing you discomfort in the area of the psoas or in the hip flexor in the front of the hip, okay? You might have this on both sides in actual fact. If you are feeling tight through the hip flexors or also suffer from some sort of back pain as well, and if you find that your pelvis tilts forward and you have a big extension through the back here, this will be helpful for you as well. Okay, so here goes. I shall do one side only, okay? I'd recommend initially getting onto your foam roller or a lacrosse ball or something similar, and immediately getting the roller right below that tight area, so just below the pelvic bone, trying to get quite deeply into the psoas or the area of the TFL, just slightly lateral to that. And there we are, and you'll note when you find it and try and keep the pressure on. Now I would recommend that you do this for up to a minute, okay? So stay on the most sensitive area for as long as you can. There we are, right there. I have a slight bit of discomfort in this left side area. It's pretty much historic now, I've gotten rid of it, but this will be of help to me today also. So there we are. First thing. Secondly, I would then recommend moving further down the thigh. Start off with your leg straight, like so, and then flex the knee and have a look around and look for tightness there and get some pressure onto it. There we are, there. And again we hold that for a period of 45 seconds to a minute. And as I said, you can do this on either side if you're suffering from tightness through the front of the thigh, front of the hip. If you're feeling tightness into your knee, or if you have that pain or discomfort in the front of the hip. Yeah, that's still reasonably high for me. Other side, for example, I feel nothing, but here I've still got a little bit of discomfort going on. So I would then move into the following sequence of a lunge stretch, right leg forward. As I'm dealing with the left leg, I move into this lunge stretch here, and I drop the hands down and have a look around, see what I can feel, squeeze the left buttock and tilt it under. There we are. That's my children outside. This is during lockdown. Georgiana, please be quiet. So there we are. I then reposition and bring myself up, squeeze the butt even more, tilt it under. Bring the left arm up, drop the hand down, grab the elbow, squeeze the butt, extend the hip forward and get a further stretch from the top to the bottom, from the elbow to the knee. So I'd look to hold this again for 45 seconds to a minute. And if you are fairly tight through, you will feel this straight away. Okay, you might not also be able to get the elbow high and drop the hand between the shoulders, because this tightness can run all the way from your knee, through your hip, the lats here, all the way up to the humerus and the arms, so it can be like a full one-sided affair. There we go. So I would follow that with a few checks on frog stretch, just to open up the hip, the area of the inside of the thigh. These muscles, the adductors, they're responsible also for hip flexion. So you can see we're into this frog stretch. I should move back a little bit, actually. And again, spend 45 seconds to a minute in this position here. Turn the feet out also, just like a frog. And maintain your spine in the neutral position, like so. I then check in to the piriformis with that. Extend the right leg back. My left leg with a right angle at the knee. And try then to direct the pelvis forward. And you should get a great stretch into the back of that left hip and the front of the right thigh, right hip. However, in this case, we're looking at tightness for the left hip, so we will be finding a little bit more when we take that left leg behind, take it back into extension, turn the body around, pelvis facing forward, and a great stretch through the piriformis on the right side. So tightness in the right side piriformis, for me, seems to go with tightness into the left hip flexor. And we've got this right on the money here. And again, I'd recommend you hold that for 45 seconds to a minute. So there's a few checks there. See how the inside of the thigh felt. Looking at that right piriformis and the pigeon stretch and the left hip flexor there. And then the main thing that comes to the party, for left side, this front thigh, front hip stretch. There's my chair, any chair at home. Squeeze the buttock, tilt the hip under, and there we are. Now, when you move into this stretch here, I would guarantee you 9 times out of 10, if you were having tightness into the front of the thigh, front of the hip, this will feel like a tremendous stretch. It will feel almost like, heck, this isn't meant to move, but it will. You just have to do this with some element of frequency. And again, we're looking at 45 seconds to a minute into this as well. Now, if you are suffering from tightness through the front of the hip, problems into the knee, maybe the lower back, this can be very helpful. I'd recommend that you could do this up to 3 times a day until things start to ease off. Drop it to twice, drop it to once a day, but then really keep your eye on everything. Okay, thank you very much. Bye bye.